if you are seeing red bands at various hospitals and schools across the country, that's because nurses and midwives are serving notice to register their displeasure over the recent increment in the cost of foreign verification fees for health workers. The government announced a new cost of foreign verification from the initial 550 Ghana cedis to a staggering 3,000 Ghana cedis, representing 445% increment. Now, calls for the Health Ministry and the Nurses and Midwife Council to review the costs have proven futile. The National Council of the Ghana Registered Nurses and Midwives Association has therefore outlined actions to be undertaken from March 22nd, that's today, to April 3rd, to register their discontent at the new fees. So this is their statement communicating their displeasure, and they say that the fees from 500 Ghana cedis to 3,000 is just unreasonable and quite disrespectful to them. And so they say that they went back on strike, they will withdraw OPD services, they will withdraw their services ultimately if their concerns are not addressed by the Ministry of Health in this latest increment that has been announced. Now, Jones Afriye Anto is the Ashanti Regional Chairman of the Ghana Registered Nurses and Midwives Association, and he joins us via Zoom. Jones, you're welcome to the Pulse here on Joy News.
Thank you very much.
All right. So you've made it clear that you undertake series of actions starting today because this verification fees has risen from 500 Ghana cedis to 3,000. And from my understanding, this is contained in the fees and charges approved by Parliament, which means that the initial consultations were done before the Ministry of Health presented this to Parliament for the necessary ratifications to be done. You didn't get any hint of this?
Nobody informed us. Even we have doubts whether that the National Midwifery Council even presented a thing before their board. We have doubts. The thing, nobody involved in any of the union, the GRNMA, which is holding the collective bargaining certificate of all nurses and midwives, were not involved. All we heard was, and even as of now, nobody has officially communicated anything to us. Even our text in Parliament is not proving anything. Meanwhile, we wrote to them on the 11th of March that we are against it, that we are not consulted, and that we should be attended to our. But as of now, we have written to the Ministry of Health, no reply, the National Midwifery Council, no reply, and the Parliament of Ghana, no reply. So we feel that disrespect is too much. And how can anybody, if Parliament really saw this and passed it, how can the people's representatives pass a price increase of 445.5% under these conditions of the nurse? How many nurses are paid in Ghana up to 3,000 cedis for you to charge verification fees of 3,000? Which a lot of countries are not even charging, because the Nurses and Midwifery Council itself trained me, gave me all the certificates, and every year takes an amount of money from me because I'm with them. And they're telling a third party that I'm a nurse registered in the country, I'm a midwife registered in the country of good standing. They say they are taking 550 cedis. Even that 550 cedis, what effort have they put in place to be able to charge that? Meanwhile, it's not only that, they say they are increasing it to 3,000 cedis. This is not fair. This is it's just disdainful and disrespectful to us as a profession.
But I mean, your understanding from what I picked earlier is that you think that this is to discourage nurses and midwives from, seeking better lives, for want of a better word, outside of the country. And you think that this is not going to help?
My brother, verification is not only to allow people to work outside the country. And even if that is it the process to ask nurses not to go? Is it the process to curtail nurses from traveling? Verification is used for other things, like school admissions, like other international obligations, like working with NGOs. Even in Ghana, international NGOs in Ghana, for instance, if you want to work with them, they want to verify. Sometimes people are doing their PhDs or masters in universities abroad. Sometimes even as a distance education, they need all those things to be able to do it. By the way, over 5,000 nurses and midwives are in the house. So where do government of Ghana need nurses such that you say you have over 5,000 nurses and midwives in the country, employ them, you will not employ them. If some of them are leaving, you say we will not allow you to leave. And my brother, you know the cost of even air tickets. You know the cost of air tickets. Well, 3,000 cities able to deter somebody who really wants to travel from traveling. It's just not right that this will be the measures that you will put in place to prevent a nurse or midwife from traveling. It is just unheard of. It's disrespectful to us, and we think it's not fair under the circumstances.
So your mother or union, the Nurse and Midwives Association, what their reaction to this? How has it been? Are they for or also against these new fees and charges?
We cannot be for it. The GRNMA is definitely against it. We cannot be for it, and that is why we wrote on 11 March protesting against it. And they have not even given us a common reply that your letter is what does, and then we are even thinking about it. Possibly they are thinking that they will not even consider what we are talking about. And that is why today, from today to 27th, all nurses and midwives in the country are going to be in red bands protesting. And after the red band, 28th, if they don't do it, we will draw OPD services. And we can assure you that by 3rd April, if they have not done it, we are going to withdraw all services.
And this will be a nationwide action? I'm asking whether this will be a nationwide action.
Definitely. And this is nationwide. Anything we are saying is nationwide.
All right. Thank you very much, Mr. Fianto. He is the president of the Nurses and Midwives Association, and they are clearly not happy with the announcement of new fees and charges for verification. And from what we have picked, it has jumped from 500 Ghana cedis to over 3,000 Ghana cedis. So if you want to be verified for any international deal as a nurse or midwife, instead of 500 Ghana cedis, you'll be paying over 3,000 Ghana cedis. And that is the situation now.